ये एंट्री कॉलम इसकी बन रहा है व्यू देखो ये इस तरह
So here, I heard someone say that. I'm going to try to go a little lower just to show you. Shoot that.
It's Ali oblique view?
What's that?
View.
Operator. I start on an operator oblique standard, and then when I insert it, I put it on the outlet. For some reason, I can't explain it. My brain works better with this one. Just to start. Shoot there. Shoot there. Slipping a little bit, sorry. Shoot there. Shoot that.
Do you have any tips for making sure that wire doesn't flip when you're
Just what I did. Like just start it like this.
Start
make a pilot hole.
raise your hand.
Or honestly, in a person, I use this is my flow on this system or any cannulated screw is a pig sticker.
Yeah.
I just hold this. I hold the pig sticker. My assistant puts it in. All right, Lee. Can you go back to neutral on the C and then tilt toward the head? Keep going. Keep going. All right, try that. Shoot there. And shoot that. Yeah, that's pretty much done. Like, now I want to show you too. Here, unlock this for a second. Shoot there.
अभी इनलेट व्यू करा रहा है
Shoot there. Shoot there. I'm just trying to offset that a little bit. So where you see the pubic tubercle, this is your superior ramus. Back here is going to be your inferior ramus. Shoot that. This is shoot there.
So what did you say when you get happy with the view? You said I'm happy with the view?
Yes, let me try that again. Can you go a little less tilt? I want to just offset these just a hair. Okay, good. Shoot that. I will usually go through this exercise just quickly because I don't want to confuse the inferior ramus with the posterior ramus when they're perfectly over top of each other. If you have like an off-axis inlet, it helps. If you see the pubic tubercle and the anterior cortex, this is your superior ramus. Anything back here that goes to your spine is your inferior ramus. So you can criticize me that I'm heading a little posterior, but this is a pretty wide model, so we'll be able to get all into here. All right, come over the top 30 degrees again.
The thing to take consideration is
We talked about that.
the superior ramus.
The one that you can see that is contiguous with the pubic tubercle and the anterior cortex. This is the superior ramus. This is the inferior. And if you aren't sure, the way I have found very easy to do that is I'll just take like an AP, have them unlock this, run a live view, and then go to an inlet. And you can literally just see them start to overlap. And then you can just unwind the inlet a little bit and you'll be able to figure it out. Shoot that. Yeah, that's sloppy, but that's pretty good. We'll be able to come down over that path.
Yeah. If you put an anterior flow straight,
Same principle, isn't it? Yeah. I guess just because this was sort of this is how you do it. Like if you have which is really.
But you probably need a higher bend. No?
It depends on where the front. I tried to go one time and it didn't work because the bend was too sharp. The inferior spine over the joint and then down the posterior column like that, and it's like a big C. It didn't work. It didn't work. All right, so for this, I'm just going to kind of show you these tubes. So you could hit it in place. I got the wire here.
Okay, this is to stabilize. ये स्टेबलाइज करने के लिए स्लीव लगाया, स्लीव के साथ एक और वायर लगाया ताकि ट्यूब स्टेबलाइज हो.
It's like a suprapatellar nail.
Yeah.
That's kind of nice.
This will protect the sleeve. Sleeve will be fixed. And the sleeve will not move with
This one is actually clipped in so that because this angle is always downhill, this you have to like forcibly.
So it can't fall off.
Yes, exactly. So you have to like separate it.
I mean, this posterior column almost
So shoot that. You're gonna see those wires that are in there. So now we're gonna do the opening drill.
Does the first generation of this have this sleeve?
No,
with the guideline?
no sleeves whatsoever. And I will tell you why this is so big, because what would happen is you would do this, you would open it.
Wire comes out. Yeah.
Yes. Shoot there.
And then you lost. Yeah.
So this drill is not a positive stop on that
Shoot that.
sleeve. Yeah. So it's important to know that.
Shoot there.
So if your position is not okay, you will remove this wire and again do the same thing.
Shooting.
Really wanted to.
So that's, that's okay. That means yeah, there you go, exactly. What are you saying, I'm sorry?
If your position is not okay, you will remove all these and place it again.
The wire, the starting wire?
Yes.
Yes, I would just make sure I was okay with the starting wire before I proceeded with anything like that. In the old generation, you would just say, now everything's out, and you have an incision like this, and you have to take this tube, and you're like, it's so stupid. But it is what it is. Shoot there.
But you've already put your guide wire on.
Shoot there. Okay. So now we're gonna reset. I had a cleaning wire.
अभी anterior column screw डालेंगे.
I'm with you. Some surgeons ask for it. I haven't asked for rationale.
For what?
Why would you want to bury the starting drill further than the notch? Like what advantage does that
The only thing I could think of would be in the posterior column if you wanted to make sure you drilled across the SI joint. But because that's sort of like the initial thought was this was going to be a posterior pelvic implant. And
so you
sort of
compress
morphed
the
from
SI
that.
joint.
Not compressed, but you wanted to make sure you get across like the three cortices to make sure that the implant would seat fully, because that was a big, thicker driving end.
I think the main benefit would be surgical time would be reduced with this way.
I think so. With the anterior column for sure, because then you have to like bend a little wire and drive it through and see if you can get a straight screw through. I agree 100%. Shoot there.
Surgical time would be reduced.
Shoot there. Shoot there.
Where we see it a lot with the SIs is
Shoot there.
ये पहला स्ट्रेट फ्लेक्सिबल नहीं डाल रहे हैं ये फ्लेक्सिबल है
where you shut down.
चेक करते जा रहे फिर वो स्टैंडर्ड से रोटेट
Shut
करेगा
down with an S2 screw, hold that compression, Curvafix in, and that actually the neutralization plate, so that the force is acting on your S2 screw to back out.
Shoot there. Shoot there. Shoot there. Shoot there. Shoot there. Shoot there.
I don't like it.
A little close at the end.
When I saw it, I was like, everything about it.
Shoot there.
I like it.
Can you go to the inlet view now? You can go neutral on the tilt. Probably just see back to neutral.
I've not been receptive.
See back to neutral.
चाहिए अब चूरा तो ब्लीच और प्लस
And then like 10 degrees toward the head. We'll just see where we're hitting it. Alright. Shoot there. Alright, so we're heading kind of close.
Sir, why specifically 10 degree tilt?
I'm just trying to find this.
usually
I'm
we
just
go
trying to
for
find
the
this patient's inlet view. That's all. I'm just matching this pelvis because I have it like propped up in here. You just want an inlet. You just want a good inlet view. Shoot that. So that's going away. So I was doing this but not saying it. Usually when I'm putting this in, I keep my finger between this and this because then I can tell, is it advancing? I just can kind of feel it a little bit. Shoot there.
I mean, there's been talks about
What for you is a good inlet of the front of the ring?
When you see both rami overlap,
Okay.
you know. Shoot there.
They started, they only top starts doing the side screws, but now actually you have all these, yes, which makes it,
So right now I'm not checking a lot of x-ray because I'm feeling it advance and it's kind of going easy. And while I don't usually do these on plastic bones, that's usually in a real person a good indicator you're safe. So I'm just kind of letting it go. Shoot. Shoot there.
yeah, but the problem is this would let you be too flexible.
And during per-up, use the outlet view as well to see if it's coming anterior or not. Outlet view.
I will use an obturator outlet. Because then it's looking at an outlet of this part of the pelvis rather than this part.
Outlet.
Can you now come to 30 toward me and like 30 towards the foot? I'll do that now to show you.
So your start point used to operator,
Yeah,
and then you can
do it.
outlet
You
once
can
you
do it
start
after
doing
an outlet. You can do it. It's fine. It's one like extra, and then toward the foot.
This is the most important view. This is.
Yes, that's good. Okay, that's good. Come toward me a little more. On the C. Yep, and come proximal. Okay, just shoot that. I'm not sure what that's gonna look like. Sorry.
That's fine. Perfect.
Perfect.
Perfect. You are doing it perfect.
Not always. Shoot that.
ये चीजें हमारे पास नहीं है
I know, well, someone does it quite a bit.
मैं वो करता हूँ
Shoot there.
नहीं मैं तो इलास्टिक वो यूज करता हूँ मैं इलास्टिक वायर यूज करता हूँ इलास्टिक वायर नहीं चाहता है बाल्टी निकल जाता है हाँ आप करके देखिए इलास्टिक वायर नहीं बस इलास्टिक वायर को स्क्रू से गुजरना चाहिए वो जो निकालते हैं वो टेप पे बैंड ना वो निकल जाता है मदद से कर लिया ट्राई कर लिया इलास्टिक
Okay, shoot that for me. So it's kind of heading down, so I'll just kind of adjust that.
सर
to
मैं
spin
तो
it.
इलास्टिक नहीं यूज करता हूँ ना इलास्टिक जो नहीं पतले वाले जो स्क्रू से क्रॉस कर जाए उससे फिर ये कि आप मज़े से नेगोशिएट कर
Shoot
सकते हैं
that.
लेकिन इसमें तो ये है ना कि एंट्री का मसला ही नहीं है जो कह रहे थे टाइम कम
Almost
मेन
done with
बैंक
this
से
one.
टाइम कम है
Shoot that.
ये जो ये सही डालना होता है जिस तरह हम डालते हैं लेकिन जो पोस्टर काला है ना वो इसने क्रैश से डाला है क्रैश से हाँ हालांकि हम अंदर से डालते हैं इसने क्रैश से डाला
All
है
right, why don't you go to the inlet view now for me? So this becomes a little more important if you're trying to go across the symphysis because you want to try to really hug the back of the ramus.
That's what I was asking.
Oh no, sorry. Go to neutral.
You're trying to go across symphysis. Are you still using the same start point, or are you offsetting it a little bit?
Start point is not as important. Come to like 10 this way. Not as important as your approach. So I think about it like, you're like landing a plane on an aircraft carrier. Like your approach is what matters. Tilt for the head 10. Okay, good. And then I come a little distant. And I'll show you on the screen where I think that should be. We're developing, we're trying to honestly develop this is the technique to get across the symphysis, but it is really challenging and it's dependent on the pelvic anatomy.
Yeah.
Shoot that.
Iliac oblique view is also required. We want to iliac oblique view is also
On
required
this one, I don't usually check an iliac.
because we want to see is it going into the notch or not. Inferior penetration.
You're way above that. You should be okay. You should be okay. Unlock your tilt. Shoot that. Shoot that. That one's going a little anterior. That's fine. So I'll adjust this and show you. Leave that view. Yes. So it's exactly what I'm going to try to do here. Just
It's coming out anteriorly, probably.
It's still in the pubic tubercle, so I'm going to back it up a little. Shoot that. Shoot. 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 So you'd want... Shoot. You'd want like that approach.
Okay.
You'd want to be really hugging it. Shoot that. It might go in the other way. Shoot that. It's starting to change.
Starting to change.
Shoot
Very
that.
nice.
210. So that might work on this anatomy, but you'd
It's
want
pushing
this to be like here.
Yeah.
Because you have to go across the symphysis, almost like perpendicular to the cortices, because you have any obliquity, it's too much of a kink in the implant.
Sure.
And then once I'll do that, I just ream across it and make some like a dilated space, so it's more like a tunnel rather than two pinch points. And then you can drive the wire up. But this for an intercolumn, I would stop
fine.
here.
Okay.
Like this, there's nothing else you would need to do over here. It's way too clunky to try to get across the symphysis in a lab. But some pointers. I'll make a small fan and steel, like this. honestly.
to hose you a little
Just
bit.
get through the rectus so you can feel things, and then you can put like honestly like blocking wires.
Okay.
Just like as
That's
little
what I was gonna
backstops,
say,
like sequential backstops, and have it march that way.
Uh-huh.
And then, like I was saying, as soon as I get across, I'll just take a reamer and punch a hole. And I think it's the most beneficial if you're going across the symphysis to cross the actual cortical bones perpendicular.
Yeah.
And then once I punch that hole, take the reamer out, and then get the T-handle back on, and then drive the curved wire up. Once you get past about here, you can just put the implant in, and it just like finds its way.
Is it easy to press the pubic symphysis?
Is it easy? No, it's challenging. Nick Crescetti, who's at that station, he's probably done it the most of anybody. I've probably done it like 7 times, and I've probably tried like 12 times. It doesn't always work. So like, I've had to like stop and then do like a retrograde implant to get the other side. It's just nice if you can get one implant to stabilize, like let's say you have bilateral pubic roots. Yeah. They'll give a ring in the back, you fix the back, and then you have like these pubic roots, or like a ramus and like a parasymphyseal pubic body. Just wrap that thing around one implant. It's nice. It's a nice little.
If you could already open it, why not just internally fixate it at that point? If you're already going to open to like, you know, get the reduction and all that, rather than just...
because if it's like a root, then I have to do like more of a stoppa to get like all the way up here. And I'm not like plating if it was just for like a symphyseal dislocation, like a pure joint thing, then I would just plate it. Okay. We're working on something for that. But if it's like a pubic body even, let's say it's a pubic body, or like right parasymphyseal fracture. There's like not a lot of fixation right here. So spanning it to this side, I would probably span the plate. And then you can't really fixate here, so you got to come up to here anyway. I don't know. I mean, you could. I'm not saying it's the only way.
I've done it for, you know, symphyseal disruption, but with roots also next to it. So it's like doing 2 ramus screws with a plate in the front.
Sucks.
So, yeah,
It's hard.
so it's
a lot of juggling.
Yeah, so it's like I was wondering, it's like, could you modify your plate versus doing something?
Have you
like
seen the Denver Cyril Moffrey's technique of that W plate?
Yeah.
That's kind of cool.
Yeah,
That might help with that.
Yeah.
If it comes out
Yes.
just to the pubic symphysis, and from here you hold it, and then you re-guide it to the opposite symphysis.
So we've done that too, where you just like pound
Small,
the wire
small
out.
incision.
One incision, or through that incision, we'll just like make a trough or a hole on the contralateral side, and like as like a
Then guide
landing
it.
zone. And then it's just like a wider landing zone, and you can get in through that hole. It's tricky. I'm telling you, master the implant before you try to do the symphysis, because you're gonna get too frustrated and like. I mean, it's not. And then if you have these like females with pelvises that are like this, it's like not possible. You know, you need like a rounded pelvis or a male like this, you know, like you need more of a rounded pelvic ring to do that. So this wire's down. This was sort of the start point. I don't have to put the implant in again just to show you, but we can try to do the back, and then you guys can try to get your hands dirty on it. Is that okay? Dee, just gonna stop me. That one on a fairly good size anterior column, like a pubic ramus, I just kind of like twist and tap and twist and tap. Once I'm past the joint, like twist and tap, and it walks its way. Like you just want to make sure that when you get to like here, you can deflect so that it starts to come back around. With the mistake I made the first
You also
time.
put the anterior column screw in a prone position.
In prone position, yeah, you can do it in prone position. It's hard in the lateral position.
Bit difficult. As compared to anterior.
As compared to supine? Well, the difference is with supine, you're always kind of working down below the table. I mean, I put anterior column screws in prone for like transverse posterior wall acetabular fractures. Usually, in these cases, there's other things like going on, like a ring or something else where you kind of need to be supine, but you could certainly do it. You just have to reverse your angles.
Because like transverse fracture, you want to fix from the posterior. And then you want to put the percutaneous screw in the anterior.
Yep, if you want to do that, like where you
For the
plate.
transverse.
Yes, if you just want to put like, if you have a pure transverse and just plate the back,
in
and
the
rotate,
back
and
and
that'll
bottom.
hold your reduction, then you can just put a perc interior column screw. Yeah, you can certainly do that. Do that prone. I'm trying to think now if you said that, if I've ever done a prone Curvafix. I don't know that I have, but I don't think it'd be any different than doing an anterior column screw prone. I mean, which is, the trick is when you're lateral. You can't really get Judai's lateral.
Lateral is difficult.
Because normally if you're doing that, you're already getting the reduction of the anterior column, and then as long as you get that, you know, a straight implant would
Probably be fine. But I'll tell you this, and I don't advocate this everywhere. Once you get really good at this, the fiddle factor is actually less with just walking that wire through a curve than it is like trying to. Or like what'll happen is like your screw will come out like here.
Right.
You can't make it all the way.
Right.
You're like, where's that vein?
Recently had that happen. I was really pissed off about it. So,
Yeah, that's what, like this you have one time. You're like, oh, it's past fracture. It's like you're kind of giving up, but not really. You're like, I couldn't really get it all the way down. It's like,
I got 5 threads across. I think
it's good enough.
And you can just
Or you can do like 2 plates in the back, then it's derotated or something.
Tips on for let's say you're using a straight screw about determining both your start point and your trajectory.